Hello, I am Dr. Shahid Abbas, Consultant Allergy and Immunology, and also President of the Pakistan Allergy, Asthma and Immunology Society. Today I want to discuss with you about the celiac disease, and huge number of people are in fact suffering from the celiac disease, but only 30% of the patients are diagnosed properly all over the world, whereas 70% people who are suffering from the celiac disease are not diagnosed. Those 30% people who are diagnosed, they are told to avoid the wheat and wheat products, and gluten-free diet should be taken all their life. In spite of gluten-free diet, they develop some complications. And what about the 70% people who are not diagnosed? Those people, they are not diagnosed, so they are not treated, and they develop very severe complications. A sublingual vaccine or sublingual immunotherapy for the celiac disease. So you don't have to take the injections, frequent injections. This vaccine for the celiac disease can be taken sublingually. We presented our research in the World Allergy Congress on 15th of October 2022 in Turkey. And we informed the world that our vaccine, the immunotherapy, is effective in the celiac disease. What are the autoimmune diseases? Autoimmune diseases are the altered immune response against the self-antigens. Body starts reacting against itself. Body starts damaging itself. And nothing from outside comes. And the examples are the celiac disease, rheumatoid arthritis. Allergic diseases are immune diseases. These are due to the altered immune response against the environmental antigens. And those environmental antigens can be pollen dust, molds, or food proteins like seafood. That celiac disease or ulcerative colitis can coexist with allergies. And the person is having both celiac disease and the allergy to wheat. What is important in the wheat which is causing such huge problems? Wheat has got in fact 4 major proteins, that albumins, globulins, prolamins, and gluten. And gluten has got 2 components, glutenin and gliadin. Interesting to know what is gluten. The gluten in fact has 2 component proteins, which is glutenin and gliadin. In fact, the celiac disease is caused by and aggravated by both glutenin and gliadin. Below that, there is a celiac disease symptoms. Bloating is there, nausea is there, fatigue, diarrhea, cramps, abdomen, headaches, stomach pains, weight loss, gastrointestinal. And on the right side, you can see, in fact, it is affecting every system in the latest research on the celiac disease and the gluten. They have determined the epitopes on the molecule of the gluten, which can cause the immune response and damaging effects on the body. So when the cause is known, that these gluten and these epitopes are causing the disease, why not to use the immunotherapy, which is scientifically proven to be effective against. On the left side, it's showing how the peptides are going to the peptides of the gluten are causing the immune response and damaging effect. And the right side, the NextVax2 vaccine, which is injected and which was developed by the multi-center study by United States, Australia, and New Zealand, how this vaccine is injected and how it is causing the immune response. Our sublingual immunotherapy for celiac disease. Here, the vaccine is given sublingually in the same way it is entering the body and causing the immune response, stimulate the production of T regulatory cells, which repair the damage done by the CD4 positive T cells. The T regulatory cells are produced in a huge number. They start producing the anti-inflammatory cytokines. and they suppress the CD4 positive T cells, which produced pro-inflammatory cytokines. Most of my patients, they had the celiac disease along with the wheat allergy or allergy to other foods. So sublingual immunotherapy was given to them, and we told them to stop the wheat for 4 months. In 6 months, the improvement was tremendous, and anti-tissue transglutaminase antibodies were reduced in about 80% of the patients. After 4 months of stopping the wheat, food challenge tests were done. The patient was allowed to take wheat for 1 day and avoid other foods also, to which the patient was skin prick test positive. After 4 months, then the challenge was done, and the patient for 1 day, and the parents were asked to report of any symptoms if they have after having a wheat for 1 day. And if anybody had the symptoms, then the wheat was stopped for another 2 months. 50% improved in first 4 to 6 months, and 90% in 1 year. The symptoms were improved, gained weight, height also improved, and reversal of anti-tissue transglutaminase antibodies too. Immunotherapy for celiac disease and allergy. Efficacy of epitope-based immunotherapy, that is NextVax2, which was developed by New Zealand, Australia, and USA, and was given by subcutaneous immunotherapy or injections. Frequent injections had to be taken, and it was found to be effective in celiac disease. We have demonstrated the efficacy with whole wheat extract immunotherapy by sublingual immunotherapy, and the effectiveness was really remarkable, and about 80 to 90% patients, they improved within 1 year.